Okay. Good afternoon, everybody, and welcome to today's CF Town Hall, focusing on our Compass program. Just a few housekeeping reminders. Please make sure to keep your microphones muted for now. We will allow for time for Q&A at the end of the call, so have your questions ready. And always feel free to use the chat feature to enter any questions as we go through the presentation, just in case something comes up, and we'll do our best to get to it at the end of the call. So now it is my pleasure to introduce today's presenters. We have Colleen Shanahan. She is a case manager with the Compass program, and we have Courtney Trout, our Compass operations manager with Compass program. And so welcome to the both of you. I've had the pleasure of working with Colleen in the past at our local chapter, so we're so thrilled that she's helping out with the Compass program now. So I'll turn it over to the both of you to introduce yourselves, share a little bit more about our Compass program, and kick off the presentation. So thank you.
Thank you, David. I'll go ahead and go first, Colleen, since you will be doing the vast majority of the speaking on the presentation. Thank you for having us, David. Again, my name is Courtney, and I am one of the managers with the Compass program. I've been with the CF Foundation for actually just past my 1 year mark last month, but prior to joining the foundation and the Compass program, I did work as a social worker at a cystic fibrosis center that cared for adults with cystic fibrosis. And I worked there for just a little over 11 years prior to joining the foundation. So
cool. We love Courtney. I am Colleen, as David mentioned. I did start my CF journey in the Chicago chapter, working on Cycle and Great Strides. Shout out Hannah, one of my first managers. And then got the privilege to join Compass just about 3 years ago. And I've really enjoyed being able to work with the community on these issues. So very fun, very rewarding. So we'll talk a little bit about Compass and our services and how we can help and some case examples. And we'd love for you guys to reach out to us after as well with any other questions you guys have. So we can go ahead and get started. Courtney, if you can go to the next slide.
absolutely.
So just a little bit of description of Compass. So we're a team of case managers who provide personalized one-on-one services to help the CF community with a multitude of things, like navigating insurance, financial, legal, and other complex issues. So we do kind of it all. Go ahead and go to the next slide. This is our wonderful team that is ready to assist you. So with our team, there's lots of different colors. So we're led by our fearless leader, Jessica, on the far left in blue. And then our Compass operations managers, Aaron and Courtney, in purple. Yamini and Aaron are our senior specialists in green. And then the 5 that you see in orange, they are our senior case managers. And then the rest of us are just plain old case managers. And you'll see the yellow stars, the 3 yellow stars, those are our 3 bilingual case managers who speak English and Spanish, who are ready to assist. And then we're also all trained on, let's say the 3 of them aren't available. We're trained on utilizing a language line that has access to 100 different languages. So we have lots of different, we try and, go to what the community needs. So that's our team, all ready to help you. So we'll go to kind of what the process looks like when you have some sort of Compass issue that you're like, I feel like this is what Compass does. So we'll go with first identifying that there's an issue. You can go to the next slide.
Oops, sorry.
So these are just some examples of concerns that community identifies that we can assist with, but it's in no way an exhaustive list. So for example, if you're switching jobs and need help assessing what the new plan coverage is like through that new employer, or maybe your Medicaid is ending because the public health emergency ended, and you're needing to find new insurance options. That's a big one. Or let's say maybe you felt okay to choose a plan, but now that you're choosing the plan, you're having issues maybe at the pharmacy, making sure that your new coverage is recorded correctly at the pharmacy and that they're running everything correctly. We can certainly help with that. Additionally, if you're enrolled in a plan and you're having some coverage issues, you go to the pharmacy and they say, oh, it's actually going to be, X amount, which is much more than you anticipated. We certainly help with that, seeing what the issue is, and then referring to some financial assistance from there. And then lastly, anything with CF. That's a very broad topic, but things like rent, mortgage, other monthly bills, that certainly affects the health of the CF community if we're worried about rent and mortgage and things like that. So what we do in that situation, we just research organizations that may be able to help. So we don't provide direct financial assistance, but we're the ones who, scour Google and try and find some resources, and we kind of go from there. So again, not an exhaustive list, but these are some examples of some issues that the CF community identifies. And then you can go to the next slide, Courtney. So then the next question is, am I eligible for assistance from Compass? Next slide. The answer is yes. So resounding yes. So services are for anyone in the CF community, people with CF, no matter your transplant status, pre, post, anything of that sort, families and caregivers, as well as providers. Compass is free and confidential, and there's no insurance, income, or citizenship criteria. So we do often have someone coming from, another country to come to the US. And so we kind of meet you where you are. So no citizenship criteria required. Next slide.
I do apologize, Colleen. Like some of these slides, like they're kind of jumping. So I will jump back for folks if we're on the incorrect slide. So it's kind of strange.
Okay. So we have identified that there's an issue. We've realized that we are eligible for Compass services. Next up, contacting us. You can go to the next slide. So there are 3 ways to contact us. The first and most preferred way is to call us, as many of the concerns we address are complex, so it's a little bit easier over the phone. Our phone number here, it's 844 and then Compass, which ends up being 266-7277. So our phones are on Monday through Thursday, 8 a.m. to 6 p.m., and then Friday, 8 a.m. to 4 p.m. Central. And then we always pride ourselves with no hold time or very short hold time, maybe on busy times. So we always have case managers available. We know your time is very valuable, so we try and really answer calls as quickly as possible. We know also it doesn't work for everyone to be able to set aside time to call us due to busy schedules and what have you. So there's 2 other ways to contact us. You can send us an email, and our email is there. And then just describe as much detail as possible that you can about the issue and what's been going on, and we can assist from there. And then lastly, our last option is you can submit an online service request. And the way you do that, you just go to our main website, the CFF website, and then in the top banner, there's a support button. And then if you scroll down a little bit, it says submit a Compass online service request. So that is certainly a good way as well. So depending on the concern as well, we may need to collect your consent to be able to work on your behalf. Again, depending on the concern, so that way we can call your insurance, we can call the pharmacy, we can call your care team, just so that we have a little bit more flexibility to talk to whoever we need. Next slide. So let's get to work. We've done all the things. Now let's work on the case. So you can go to the next slide. So we'll work to your level of need. I really don't have many cases that are the same in any way, shape, or form. So always working to what you need, depending on the issue. Like I said, we may need to call your insurance or pharmacy to confirm coverage, or maybe connect with your care team to get more information on any prior authorizations that have been submitted for medications. We know the CF community and the care teams are already so busy. So we really try and save time for everyone to call insurance ourselves to take some of that load off. Life is already busy enough. And then if we're researching any resources, we would go ahead and start looking at resources locally and nationally.
Sorry, I don't know why it's doing that. My fingers are not on the buttons, I promise you.
So looking at resources locally and nationally that you may be eligible for. And then we can work fully on your behalf to resolve an issue, take you along with the process with us, or really just provide information and tips if you're someone that likes to take the lead. For example, we had one person who called us 1 year needing help choosing an insurance plan. She really wanted us to find that. She was overwhelmed, and we did the heavy lifting and finding and comparing her insurance options. Then the next year she called back, but she felt more confident. She was able to work more side by side with the case manager. And then the next year she called and had done all the work and just wanted someone to double check her work and get another set of eyes. So our main job is to educate so that you feel confident in making those insurance decisions, and we're along every step of the way with you. Next slide. So here's, again, just a little bit more information on what we're doing. So like I said in the beginning, if you're getting a new job, we'll provide a side-by-side health insurance plan comparison. It's a big PDF that will go through every single thing, primary care, specialist cost, any sort of diagnostic testing, ER, inpatient, anything that the CF community would need. We will make sure that we know what the cost is going to be before we sign up. We'll verify insurance coverage and any sort of expanded benefits you may be eligible for. Sometimes Medicaid plans have expanded benefits, or Medicare plans have expanded benefits. So we'll look into that as well. And then we'll troubleshoot any insurance coverage and any sort of reimbursement issues. So insurance not covering anything, a specific medication, or whatever the situation is. We help a lot with that. Lots of connecting you with financial assistance and support programs. This is going to be like medication copays, which I know is a hot button issue. So medication copays, certainly doctor appointment copays, things of that nature, financial assistance and support. And then we'll assist you in getting some answers to legal questions about laws that protect the rights of people with CF. The way that we do this is we will research local pro bono resources that may be able to help, as well as referring to another organization that typically helps with like disability, employment, education law. But that organization doesn't provide any representation. So we focus on, those three kind of buckets: disability, employment, and education. 504 plans, any sort of employment discrimination, being able to have reasonable accommodations, things of that nature. And then navigating resources and coordinating benefits throughout the transplant journey. This can be lots of different things. The transplant journey is very complex. So that can be lodging, transportation, making sure that insurance is going to cover the transplant, how they're going to cover the transplant, and then financial assistance if there is any sort of leftover cost after insurance. And then we like to share educational tools and resources for navigating life with CF. So lots of resources, for you to then take it from there and take it upon yourself to have some resources on your side as well. So that's kind of how we work the cases. And now we're going to go to some case examples to kind of give you, it all sounds good in practice, but we'll kind of give you some examples of what's going on. So this first one, a parent of a child with CF reached out to Compass during our open enrollment for help navigating insurance options. Both of the parents in the family were self-employed, so they did not have access to employer coverage. So we assessed them first for Medicaid, seeing if they were eligible for that. They were over income, so then we looked at the marketplace, the federal marketplace, Affordable Care Act, lots of different names for that, but that's where we then went after that. So the problem really was that we had a hard time finding a marketplace plan that was in network with the care center. And what we did, we actually connected with the care team who advised that contracts with the insurance company would be changing for the new year. It's not always that CF care teams know about, the ins and outs of the contracts changing, but it worked out just perfectly. That was what happened. Doesn't always happen like that, but it was perfect. And then that outcome, we were able to enroll them in a plan on the marketplace that would be in network with their care team for the next year. So good things there. You can go to the next one, Courtney. So this one, I talked a little bit earlier about the public health emergency. And with that, so during the public health emergency, no state was able to kick anyone off of Medicaid. But with the public health emergency ending, now states are able to what is called redetermination of people on Medicaid. So this individual was told that with the public health emergency ending, they were no longer going to be eligible for Medicaid. So they reached out to us to assess what their next options are. As you can imagine, this person was only ever on Medicaid, so they didn't have as much knowledge about commercial insurance. So not only were we looking at their insurance options, but we were also really trying to educate so that individual knew what they were getting themselves into, the ins and the outs of the plans and how things were going to work. And then we were able to enroll them in a plan on the marketplace, and they were able to use copay assistance to keep the plan affordable. So we look at the plans, we educate, and then we look at some copay assistance for any of our medications, any sort of monthly premiums that are high. We really try and work with you on making sure that all of these things are as affordable as humanly possible. You can go to the next one. So this one, an individual with CF reached out to Compass about scholarship opportunities, which is not something that I feel like the CF community knows that we can assist with. So this individual shared their health had improved and they were interested in pursuing a career in cosmetology. She was accepted into the school of her choice. But as we all know, that can be expensive. So this individual needed some support with paying for the costs and the job training. So we connected them with a program called vocational rehab. And that is typically county specific. And this program can help with education, costs, and then training. It's dependent on the state and the community and the county and things like that. But they were also able to get help identifying job opportunities after the education had completed. So it was a full life cycle program that typically people with CF can utilize. So this was great that this individual was able to use that. Next slide. So this one, a parent of a child with CF reached out to us that her daughter with CF was almost out of Trikafta, and there were some insurance issues with filling that were preventing them from filling. The child was recently just added to both parents' insurance coverage. So now she had a primary and a secondary plan. So the problem was determined by the case manager that the primary wanted one specialty pharmacy and the secondary wanted a different one. So the solution, the case manager figured out which one was going to work and then redirected the prescription to the correct pharmacy, making sure that the pharmacy was billing primary first and then secondary. And then the outcome, they were able to fill the medication without any gap in therapy and was able to make sure that this individual had no out-of-pocket responsibility for Trikafta. Yes. So wanted to go over a little bit of numbers in 2023. So in 2023, we had nearly 7,000 requests for help. We evaluated over 2,000 insurance plans and helped save nearly $2 million for the community. This was by referring to copay assistance or any sort of resources for monthly bills, rent, mortgage, utilities, things of that nature. And then some trends that we saw in 2023 was an increase of need of helping to pay for medical expenses, whether it be durable medical equipment like the vest, any sort of inpatient stay. I mean, it really just runs the full gamut of those medical expenses. We're seeing a lot more complex insurance issues. Again, just like my example was with 2 insurance plans that had conflicting wants. So more complex insurance issues, navigating copay assistance and how we can use some programs for this and then other programs for this and make it all work together in a cohesive manner. And then certainly an increase in living expense costs. So again, rent, mortgage, other monthly bills. We like to try and, let's say, for example, the medical expenses are high, and we start with the medical expense resources, but we're not able to find something with that issue. That won't go to any sort of resources for living expenses to help offset the costs. So we really work very creatively to try and find some sort of resolution, some sort of assistance that you can utilize. And then you can go to the next slide. So just some other fun Compass numbers. So we have a 90% satisfaction rate, which is above standard industry numbers for our services. So that is great. And then in January alone, our Spanish calls were up 6% higher than our usual numbers. So those 3 case managers that are bilingual were really working hard. I know that like some of our only English case managers had to use our language line to be able to assist everyone. So really glad that that community is aware that we exist. So, and then since we launched 8 years ago, we've helped about half of all people with CF. So we're not there yet, but a really good portion of people have been able to utilize our services. And even just in the last 3 years, Compass has helped over 7,500 unique people with CF. And many of those were people who reached out to us multiple times. So reached out to us, found our services helpful, and came back, which we always love. You can go to the next slide. So just talking about some educational and self-help tools. Again, if you are someone that likes to take it on yourself, we're always here, but if you want to take some on by yourself, there is so much information on our website. I enjoy just kind of poking around sometimes on new blog posts or things like that. So lots of educational content there within Compass. There is an insurance options self checklist on under like the Compass support tab on our website as well. Just gives you a good guideline of what you're supposed to be looking for, and if you would like to do it yourself. We did a series on navigating CF. So there is like this screenshot has insurance denials, how we navigate that. There's some on Medicare. So a lot of good resources. And this all came from our Compass brain. So this is basically just like a snapshot into our process. So and then lastly is a really fun thing that relatively recently came to the public eye is the Compass Resource Database. So this is a database of all of the resources across the whole US that we have vetted to be that they have funds available. There is on each like program, if you search for the program, it'll show eligibility for the program. So again, if you're looking yourself for any sort of rent, mortgage, other monthly bills, and you want to do it yourself, you can put in, so that first line, you put in rent or mortgage or whatever. And then the second line, you put in your zip code. And then you search and it comes up with all of the different programs that can help. So lots of different things if you want to do it yourself. Next slide.
Yeah, I do want to add that the Compass Resource Database doesn't have every resource out there available. It'd be nice if there was a database like that, but I can tell you that that would be completely impossible to keep up. So if you do use the database and you find that the resource that you're looking for isn't there, or maybe you don't qualify for what's listed, definitely feel free to reach out to us.
And that link to that is compassdatabase.communityos.org. You can send that out later too as well. If you just search in Google, like CF Compass Resource Database, it's the first one that pops up, just for fun. And then there's so much support within the foundation, and I just really want to make sure that everyone knows about all the different things. You know, the Chicago chapter does such a great job with community conferences and CF Cares. A lot of the Compass stuff that we work on, we also want to make sure that things like Community Voice and CF Peer Connect, we have a lot of people reaching out to us for mental health and needing support groups, things like that. So those two things are always often where we refer to. So just a little bit more about those two programs. Next one, next slide. Talking about Community Voice. So looking at community insights. This is our way to get an insight into the community and the ins and outs. And for people with CF and their families, a big community there. All opportunities are virtual. So lots of good results have come from Community Voice and really being able to listen and grow and learn from there on what the community has to say. So it's a mutually beneficial relationship. And then the next one, lots of good things with CF Peer Connect. So CF Peer Connect is a topic-based peer support program. So this is for people with CF 16 and up, and then their family members. So individuals can talk and learn from someone else who has gone through that life experience. So something like making work decisions. You know, am I going to accept this job or no? Dating and relationships, starting a family, adjusting to a new CF diagnosis, parenting, and lung transplant. Really, again, a very wide array of topics. And then the mentors, you get paired up with someone that's gone through that. So the mentors are there to listen, share stories, provide empathy and encouragement. Not there to provide medical advice, but kind of going through what they experienced. So actually in 2023, over 150 of their matches, 9 of the matches were made completely in Spanish. So again, really trying to make sure that we're available for the entire community, and that there's no barriers to be able to access these things. So again, you can find this information on our CFF website. I believe it's under support as well. And you can submit a request form to be able to match with a CF Peer Connect team. And then that team member will reach out to you to kind of learn a little bit more about you and what you're looking to connect with. And then you get matched from there. And it's perfect. And that really concludes everything. We wanted to open it up. We've got a good portion of time for questions. So go ahead and rattle them off.
Thank you, Colleen. That was a very informative presentation. I'm really glad that you touched on the other community support programs that we have to offer through the foundation. I think it just shows our whole arsenal of programming that is out there to support the community. So thank you for doing that. Courtney, if you want to stop sharing your screen, we can go back to full screen mode. And please feel free to unmute yourselves. And if you'd like, take yourself off camera so we can see your smiling faces. And please feel free to ask any questions. And I know we had some questions that came in, through the registration process and everything, but hopefully we covered most of those during the call. But if not, make sure to reach out to your Compass contact, and I'm sure they'll be happy to give you a little one-on-one attention to any questions you may have. But I did have a question. Or Peter, do you have a question?
Not a question per se. I just wanted to say that I have two daughters with CF. They're both in their early 20s. Well, one mid-20s because she's coming off my insurance at the end of August because she'll be 26. And she's already reached out earlier this year and found she lives out in the Bay Area of California. And you guys were very helpful finding a program for her that would meet her needs and that she could afford because she's a scenic painter. So she's not making a lot of money.
Yeah.
So I want to thank you for that. I mean, it was really a great process. She hasn't signed up for me yet because it's not till August. I don't know if you can answer this question here, but how far in advance should she start thinking about signing up for September 1 start date, I guess? So.
Yeah, so dependent on the plan. So the team of case managers, we're all kind of divvied up between regions. So I am within the central region. So I have like 6 or 7 states within the Midwest. California is not one of my states. So it's dependent on the program that she's going to enroll in. Like if she's going into Marketplace.
Yeah, Marketplace.
Okay, so Marketplace. So she just has to, I would probably reassess probably August 1st.
Okay. Yeah, we were thinking July, but I didn't know if that'd
be too. I mean,
soon.
honestly, the earlier the better. Love when we have more time.
Right.
So yes, July.
But yeah, your program is awesome. It was so easy for her to use. I didn't even get involved after I sent her the phone number and email. So yeah. And I have another dog that's gonna have to do it later this year too because I'm probably going to retire at the end of the year, and so she's a teacher in New York City, so I have both coasts covered. And this is her first job. She just started in January, so we're thinking at the end of the year she'll go on her own insurance, and then I'll pay the premiums until she's 26. But it'd be cheaper for us than me to be on the Marketplace and her to be on the Marketplace or something.
Yeah, for sure.
Thank you.
Thanks.
Yeah.
Thanks, Pete. Yeah, that's a great point because, I do know as our population ages, there's a lot of people approaching that transition from their parents' insurance and coverage to having to find their own. So thank you. That's an important question. And, Colleen, maybe you could share a little bit. I know I tried to reach you guys back in September one time at a personal level, and I know you guys are swamped. What is the what's the open enrollment schedule like for you guys? I mean, I know you have some times where you're just fielding a lot of calls.
Yeah. And that's a great question. Again, reach out to us as soon as possible. So typically things start in early October, but we definitely see things happening in September as well. So Medicare opens first in the middle of October and goes to December 7th. And then Marketplace will begin there soon after. And then that deadline is December 15th. So December is bananas. So October, not really bananas. So October, November are, if you're going to be needing assistance during open enrollment, October, November are the months to get in contact with us, just to make sure that we're fully assessing all of your options. Nothing's going to the wayside. Yes, October, November, but things happen. And December can happen as well. So that's really Medicare and Marketplace. Employer insurance and open enrollment is kind of a whole other beast. Even within the foundation, we had probably, Courtney, correct me if I'm wrong, I think we had like a week and a half before, like once insurance options came out for the next year, we had like a week and a half to make the decision.
Right.
So that's a
Close to that.
very quick turnaround time, which is very normal for employers. So if, again, you're looking at employer open enrollment, as soon as you get notified that open enrollment has started, reach out to us. We randomly had employers asking for decisions that same day, which is crazy. But we really try and make sure that over the phone, we're talking about, okay, these are all the things that we're going to be looking for. And sometimes we can't make a completely informed decision within 24 hours. So then we're like, okay, January 1st, what are you doing? And kind of, again, just going along the whole process with them.
Awesome, thanks. Do we have any other questions from the audience? And feel free to use the Q&A feature at the bottom too if you don't want to unmute yourself. I know you cover a whole host of questions from our community and issues. Just curious, is there anything we can't help with or that we're unable to assist? I know personal medical issues and things like that, we have to refer back to their care professionals. But
Yes.
just curious if there's something that stumped you in the past.
Yeah. I think, Courtney, I'm sorry, did you want to?
No, go ahead. I can
So
add something if I have some.
One of the main things that we're really limited on, like you said, David, the medical care. But the other thing is kind of legal. I wish I was a lawyer. I don't think that law school sounds fun. But we don't have much information or knowledge on the ins and outs of legal issues. So that is one that we're a little bit more limited on. That in that case, we're really going to be referring to organizations, taking your income and county, zip code, how many people are in your household, and going from there and seeing what resources you might be eligible for.
Absolutely.
Awesome.
We do have the CF Legal information hotline as well, that we can refer people to, that help with things like education law, employment law, and then also disability law, in addition to helping people apply for Social Security disability benefits. But that's really sort of their main area of expertise. So we're able to refer to them, which is great. But other legal things, it definitely gets a little challenging since we are not legal experts for sure.
And I do know that one of the things we might not have touched on is, during disasters, natural disasters, and unfortunately with climate change, we're experiencing more and more severe weather and storms and things like that. And I know in the past, Compass has assisted patients and families when they're affected by a tornado or a hurricane or something. Do you have any information like on that? I mean, how do you navigate that in an emergency?
Disasters are disastrous, and it's really hard. Everyone is kind of in a frantic panic when a disaster strikes. So in that situation, it's really trying to be proactive and prepared for that situation. Certainly in the Midwest, tornadoes. I had a tornado out here in the western suburbs just a few weeks ago. So it's definitely not out of the realm of possibility. So really, like, depending on if someone has lost electricity, there are often local resources ready to help, make sure that the power grid is back up, whatever that case may be. Costco for, big things of water. And it's, conversations with the care team on like what medications need to be in the refrigerator, how long they can be without refrigeration. That kind of stuff is good to have kind of in the back of your mind.
Thank you. And thanks, Deirdre, for commenting. She'll be in touch with you guys soon regarding her young adult who's coming off of her employer plan. So that's good to know that we've helped you. And if there's any other questions, feel free. But I think you've covered so much today, and I really do appreciate the presentation from both you and Courtney today. And thank you so much. And let's see, or Maureen chimed in. As a social worker at a center, I'm so grateful for all the hard work and knowledge to help our patients. She covers a lot of other clinics, and no one else delivers this level of support. That is one of our driving factors, is to help our community. And we're always looking for more support. But thank you. And it's really interesting to see too that you find the resources to cover all of this assistance, everybody's donations, and the money we raised, all goes to our research and not necessarily to patient support, and that we are able to find these resources to support the community is really amazing. And yes, I will do my best to share the slide presentation and the information and resources that were made available. And a recording of the presentation today will be posted to our chapter YouTube page. So as soon as we can get that downloaded and uploaded to YouTube, we'll make sure to send out the notification that it's available for future viewing. But well, if there's no other questions, I think we'll say thank you again to today's presenters, Colleen Shanahan and Courtney Trout, and the entire Compass team for everything they do on behalf of our local and national CF communities. So thank you again, and everybody
thank you very much.
Weekend. And stay warm. We're going to get hit with another cold spell. So
thank you so much for having us.
Thank you, guys.
All right. Thank you. Bye-bye.
Bye.
Bye, everybody. Thanks.